going to take about 15 minutes.
Okay.
Okay. So the coronavirus yeah, okay. So I'm not sure because I'm not familiar with the, so stop if you don't hear me.
Okay? I hear you. I hear you.
Yeah. Okay, perfect. So it's coronavirus are a group of viruses that can manifest itself in many different ways. It can cause common cold or it can cause more severe illness. And the severe illness that we had was 2003 with the epidemic of SARS. SARS stands for Severe Acute Respiratory Syndrome. And then we had also another group of coronaviruses was the MERS. MERS is, they called Middle East Respiratory Syndrome. This started in the Middle East, and it affects humans and animals. And this caused a disease throughout the world in 2015, but it's a major concern that it may future pan-epidemics in relation to the MERS virus. The third group was what happened in 2019 with another SARS type, which we call SARS-CoV-2. And this is also what is described as severe acute respiratory syndrome. And this became pan-epidemic in March of this year. This started in Wuhan, China, and it is likely it started in a lab. And this lab was only 300 meters away from the market where the virus started. And we believe that they were experimenting on bats to assess if these bats have the coronavirus, and more from a therapeutic approach. And the virus escaped. And that's how it happened. This is likely the theory how this COVID-19 started. And the reason they call it COVID-19, it's in relation to the year it was diagnosed. So 19 stands for 2019. The incubation period for this virus is 2 to 14 days. And cases are, the symptoms starts with, usually patients have fever, shortness of breath, and dry cough. And with that, they have also malaise, severe malaise and fatigue, as you see with other viral illness. And one characteristic features of this virus is loss of smell and taste. And this is, you cannot make a diagnostic because it can happen with other viruses, but this is quite common with this. The severity of the virus can vary from mild to severe. In 80% is mild, and some of them are asymptomatic, but they can still transmit the disease. In 20%, it can be quite severe. And you have to take into consideration in severe cases what is the underlying risk factors. And the underlying risk factors, diabetes, age, chronic lung disease, heart conditions, and compromised immune status. And another interesting one is smoking. Smoking, it's probably also a cause by affecting the cellular cells in the lung. And the only study we have is from Wuhan, China, whereby they found out 12% of the patients who went to ICU were smokers and 5% non-smokers. So one can make conclusion on that basis. Also, vaping may have similarity, but we don't have any data on that. The initial symptoms are usually, as I said, the malaise, the fever, cough, shortness of breath, which is mild, and fever doesn't have to happen to everyone, and that usually lasts 3 to 4 days. And in other cases, when it's severe, it progresses over the next 5 to 6 days, and patient develops severe shortness of breath, chest pain, tightness in the chest, blue lips or cyanosis, and confusion. And this is indicative of bilateral pneumonia, and these patients become sick and required to go to hospital intensive care to receive oxygen, and in some cases also ventilation. Some may recover, but it could take many weeks, and others, unfortunately, may die. The pneumonia that we see in these cases are usually bilateral, and it doesn't always follow the viral load, which indicate it may be an immune phenomena causing the pneumonia, and that's why we are having more severe disease. These cases, unfortunately, we have deaths happening because many of these cases coming that need oxygen and ventilation. So I started. I was thinking about possible immune phenomena causing this severe disease. Now, the transmission is usually person to person through droplets, and the droplets could be coming in even when the person is speaking, sneezing, coughing, and this is why you have to keep a distance of at least 6 feet, preferably 10 feet, to avoid the contact. Also, you can get the disease if you touch hard surfaces. And the hard surfaces, the virus stay there for over 12 hours, as well as also material. The clothes, the virus also can stay there for between 6 to 12 hours. So if for some reason you touch this and then you touch your face, then the virus will likely go as with complications, especially if you touch your nose or your lips. And that's why also with smokers, maybe that could be an added risk. So even if you touch a hard surface, as long as you wash your hand with soap and water for at least 20 seconds, you can prevent the spread of the virus. However, if soap is not available, you can use sanitizers, but it has to be at least 60% alcohol. The second issue that you have to do is avoid close contacts, avoid big groups, and always keep the distance, what they call social distance. Try to keep it so that you don't get the virus. But unfortunately, you could be touching something without knowing. So this is important. And as I said, the virus in the hand, in the palm of the hand, stay for 10 minutes. So during that 10 minutes, if accidentally you touch your face, you can end up sick. Now, also you have to take into consideration of if you travel or if there's one health care provider that's sick, that unfortunately you may become sick. So it's important to take all the precautions. The complication that can happen is usually, as I say, severe bilateral pneumonia, and many of these patients will need ventilation for several weeks, and a number of them recover, generally more than 50% in the younger group. In older group or patients with compromised immune status or elderly, they have a high rate of mortality. And the other cause of complication is multi-organ failure, from renal failures to cardiac, and these patients unfortunately also do not recover. We also have had few cases in the literature of patients who had severe neurological deficit with encephalopathy, and these patients also did not do well. So, and the prevention, again, to summarize, the most important is keep a distance, try to stay home, and use a mask, whatever mask you have, when you go shopping or whereby you could be accidentally in a close contact. Wash the hands for at least 20 seconds, clean the surfaces, avoid touching material, and don't try not to touch your face. We tend to use the N95 masks, and these are quite protective. Unfortunately, they are not available only to healthcare providers. Yeah. And as far as the treatment, I'm going to spend 5 minutes on that. We don't have any drug that is clearly available for the treatment of the COVID-19. However, there are a number of drugs that are being used off-label and may be beneficial. One of them is the one that Trump was always talking about, is hydroxychloroquine, which is also used under the name of Plaquenil. We give it for patients with lupus. It is a drug supposed to reduce the inflammation in lupus, and many patients depending on it. Now, the benefit in these cases has been in a small, serious randomized study in China, which showed slight beneficial effect. There was also a more recent case of study in France with 1,000 patients, and they showed some benefit, but again, not a dramatic 12 versus 20%. So there may be some benefit. It is an anti-inflammatory response. We believe the disease is caused by inflammatory immune response, maybe that, but we don't have any solid data for its benefit. The other interesting thing that one of the experts on lupus was talking, that in patients with lupus, study of even cases from the insurance records of up to 1% of the people in the United States did not have the COVID virus, a patient with lupus. Is it because of the hydroxychloroquine? Is it because of other medication? And one other thing we have to take into account, patients with lupus are going to be home confined. So if they are home confined, again, they are less risk of getting the virus. Another study, which was also in Wuhan, China, using hydroxychloroquine in combination with zithromycin or Z-Pak, and the results showed a better response. In New York, I spoke with my son David. They're still using these combinations, but they still believe that they are not beneficial. But since we don't have any other options to give, the concern is that when you use the combination together, there's a high risk of cardiac problem with the prolongation of the QT intervals that could lead to serious arrhythmia. So it has to be monitored, just not given like that, and has to be prescribed by doctors, not like what the patient are getting, because it can cause serious, even cardiac arrest. So there is other medication also is interleukin-6 inhibitors. These are works on cytokines, and it may also be beneficial because this medication, by working on cytokine, which promotes inflammation, may benefit from that. Also, there's also remdesivir, which is in phase 3, and it's antiviral. So there are and supposed to be the results coming in the end of the month. But the one that is also interesting recently is they taking samples from patients with moderate disease who recovered, and they inject the plasma that is rich in antibodies, and hoping this will be benefit, because we know once you have the disease, you're gonna develop immunity to the disease, which is likely long-term for this particular, but if you have another virus that mutate, it may not work for that, but may work partially. So these antibodies, hopefully, that can benefit. And this is all over different countries, including in Canada. I'm gonna stop here. Thank you, and Chag Sameach.
Thank you very much.
Thank you.
Bekhor. Just 1 second, please. If anyone has any questions, there's a Baruch Hashem, we reached a number of 74 people that are watching. Doctor, thank you so much, Doctor, for it's a very informative, and I hope Bezrat Hashem will be able to overcome very soon this epidemic, and we'll all be coming back to our normal lives. If anybody has a question, please. I can't unmute everyone at once because 74 people try. Now we just reached 75. Please raise your hand and I'll unmute you right now. Okay, I see.
Sandy.
Right away. Just stay everybody on mute, and I'll unmute all those that want to just raise your hand. So please, Sandra, go ahead.
Yeah.
Dr. Bekhor, thank you very much for all the information that you just gave. I just wanted to know, when is the peak in Montreal? Because New York is having the peak now. So
yeah.
When is it here?
Well, I mean, I don't think anybody can tell you when, but based on what I have seen, I don't depend on how many new cases we have, because many of those also were receiving tests. However, I calculate on how many deaths. And if we look at the number of deaths and the number of patients going to ICU, I see that this is quite optimistic, and I'm really hoping that the peak is within weeks. And then after that, the curve should flatten. Okay. But I think our premier is doing an amazing job, and I'm happy. And I think soon we're gonna have the curve flattening. I would think weeks.
Thank you.
Dr. Bekhor,
yes.
Can you please clarify what's the source of the information that it escaped a lab in Wuhan as compared to being originated from the market itself?
Well, this was even some articles published in Lancet, and there are all information into that. But this is just based on descriptions that like lots of people who were involved in one of them was a scholar who worked there, and I have all the references, and then there was extensive work with bats, and then there was blood and urine all over his clothes, and so it's possible, and it was very close to the market. So we don't know 100%, and the Chinese do not give you all full information, but there's enough data that it came from a locus, and they were doing the research on that. And there was one theory saying that it started by eating bats from the market, and this is not true. They do not serve bats over there, so it has to be the virus, because that was part of the extensive study they were doing. And I don't think it was done on purpose.
Thank you.
Anyone else that would like to ask a question?
Yeah, if I may, Rabbi.
Yes, please.
Dr. Bekhor, it seems that the only salvation out of this is a vaccine. And I
Yes.
understand that the Israelis are about to come up with one of their vaccines that was used on poultry, apparently.
Yeah. Well, yeah, okay.
Do you have
Continue.
any thoughts on that?
Yeah, the vaccine is not going to do anything for this issue, but it's very important to produce the vaccine, and certainly many companies are working on that, and from Israel, very promising. However, as Dr. Fauci said, any vaccine, it's not going to be before 12 to 18 months. So it's not going to solve anything today, but we have to work on the vaccine because these viruses could come back, and some postulating it may go and come back late fall. So we need to start working on this, but I don't think the vaccine is going to be ready.
So Dr. Sabah, why would it have a peak only in 2 weeks?
Alan, 1 second, please. Dr. Sabah, we can't see your face because your hand is in front of the camera. Just to.
Okay, now, yeah.
Now we see you. Beautiful.
No, I didn't want you to see my face. No, I'm just kidding.
Dr. Sabah, so what makes us less infectious, or why would we reach the curve in 2 weeks, since
Yes.
there's no vaccine, and this is going to continue for another year?
Yeah, you see, the number one is what we're seeing, the cases today are the cases that had the infection 2.5 weeks ago, are not today. So obviously something is working when the curve is flattening, because sooner or later, with the treatment, with time, with the people are following, avoiding groups, washing the hands, doing all these measures. So at some point it's going to work. And if the curves start to flatten, it means these measures has helped. And at some point with the virus, or maybe the temperature is going to warm, many factors with these, at some point in time, is not going to stay forever. So the curve will start flattening. But the vaccine is not necessarily going to be the answer at this point, but it's very urgent to work on it, because the virus could come back, and could come back soon, but in a different way. But the same with the influenza. You go there, and the next year you get a different types of strain of influenza, but it's still, the vaccine works.
Mrs. Sharabani, please go ahead.
Yes, Dr. Sabah.
Yes.
I just wanted to know, like they said, in the autumn it might come even
Yes.
stronger than now. What are the?
I don't believe so. I don't believe so.
Oh, that's.
I don't believe so, and I believe a lot of people are had the virus, and they are asymptomatic, which means they could still transmit the disease. But we developed, all of us, some immunity that I feel that we will be able to handle better. The same thing as with influenza, that we will be more immune, rather now we have no defense to deal with it. So I think, but we have to protect ourselves, and we have to have a vaccine. Even if the vaccine is not exactly with a mutation, it still should work partially the same as what happened, as I say, with the influenza. But we can't sit there and wait that in 6 months it's going to be much worse. My prediction, it's going to be, if it comes back, it's not going to be in the fall. It's going to be maybe in a year or two, and hopefully by then we'll have a vaccine.
Mr. Eli Khadid, you have a question, and I'm coming to
Yeah.
Mirza in a few.
Okay. Dr. Bekhor, it's very
Yes.
nice to hear you and all these good informations. I am a person who is watching the numbers, okay?
Yeah.
Numbers of hospitalized cases in Quebec today is 583.
Yeah.
And since March 22nd, the number has shot from 60 or 65. Today we are at almost 600. How? My question has two questions. How many? What are the capacities of hospitals in Quebec, and as to how many patients we can take, and they don't show us like the numbers of the recovered cases. So what's going on? We don't know. Like the population doesn't know what is the recovered cases and what is, you know, the.
They have the recovered.
Well, Lego already indicated there were a few thousand cases that recovered. This is number one. Number two, we have many hospital beds. We can accommodate a lot more, but this is not what our concern. Our concern is the intensive care beds, and we're still quite far away. So we are okay. Even they have other units that could accommodate over 1,000 patients in case it's needed. So I don't feel at this rate we are at any risk, and certainly the number of deaths is only escalating by small percentage points. So to me, I feel things looking optimistic, but it has to increase the number till it peaks, and then the quicker it peaks, the faster it will come down. But you can't just say because of this and it's going to go to 600 and 800. But you have to calculate how many patients also have recovered.
Sabah.
Yes.
If when the curve flattens and then we're sent back to live normal lives for a while again, then is there the fear that then everybody back out there within 6 feet of each other, and now we're going to reinfect and go back to what's happening now?
Yeah, that's if I understood it, that's a very good question. So what's going to happen when things get better and the curve flatten? What are we supposed to do, right? Correct?
Yes.
Yes.
You see, I think it's a lesson that we should learn from it. I remember many years ago, my insurance broker never shook hands, always with the elbow, touching the elbow. I'm talking over 15 years ago. And I remember last time when I came to the synagogue, me and Maurice Abdelaziz, we did not want to shake hands. But then you get into the habit of shake hands, kiss. I think this has to stop, because it's not only now. Sooner or later, we're gonna create. And this is what's happening in Singapore after the SARS-CoV-1 2003. People automatically learn to keep distance, and look what happened now. So I think it's a very important thing that we have to learn the lesson, and we don't want to go through that again.
If I may, Dr. Bekhor.
Yes.
There are other ailments at this time not related to COVID-19.
Yes.
And if we, God forbid, somebody comes up with an ailment,
yes,
should they go to the Jewish General, which is supposed to be the headquarters for the coronavirus, or should they be going to a different hospital?
I'm sure once situations improve, they're going to have to close units at the Jewish for a while to sterilize, and it's not going to be the same units being used to put patients, but for sure if the situation just corrects itself, I would. Oh my. Yeah, if the situation just corrects itself, I would go to another hospital.
Thank you. Anyone else that have any questions for the doctor?
Dr. Bekhor,
Yeah.
It's not a question, but first of all, I would like to say how amazing your talk was, and I want to thank Ronnie Mashal for. I mean, I spoke to you about it, and I asked you to come on, but Ronnie had a better twist, and then he got you in. So I just wanted to ask you, how is this going to be for Sephardim not to hold hands and kiss? Now that's a big issue.
but you can, as I said, you can hold arms through the elbow.
Correct.
Yeah, and don't forget, the virus stay in the hand for 10 minutes. So if you, for some reason, you think by mistake you have touched something, a hard surface or any material, then make sure you don't touch your face. And if you don't have access to soap, use sanitizers with at least 60% alcohol.
I think the way we deal with people is completely going to change after this. The way we conduct ourselves and everything. Yeah.
It's very important. I hope so, but unfortunately, the ultra religious may not listen.
Anyone else with questions?
Yeah, Sandra.
For a sec. Dr. Bekhor?
Yeah.
Thank you so much. I love it because you're actually optimistic. And I was wondering, do you think we could have a normal summer, or do you think it's going to be too soon, the summertime?
Honestly feel the latest, I mean, even though I was told it could last 6 months, I would say the latest will be the 3rd week of May. That's my prediction.
Wow.
Yeah. But I mean, not 100%, but by then we'll see things flattening, we can go out, you know, like, but we don't want to start all of a sudden gathering 20 people, and even restaurants, they don't want you to be more than 4, go this. I think we should continue, even enjoy the summer, but continue to keep distance, continue to take precaution. And I think this should not be for now, for a long time.
Thank you very much.
Thank you. Good night.
Anyone else have any questions? Sandra?
Yes. Dr. Bekhor,
yes.
Has there been no doubt as to the fact that this has been transmitted from Wuhan to the rest of the world? Because the rest of China seems to have been quite saved.
Well, I mean, this is a political question, and I don't know. Yeah, this is a political question. I don't know. But the only thing, as I said, even if it is an issue with China, from what I read, it was really done non-intentional, and it was just purely a research that a mistake was made, because it's clearly, if you read the articles, there was, the way it handled, the virus could have escaped. But there are some political issues, and I don't want to get involved. Yeah.
Are we convinced, though, that there is no other fact?
Can we talk to you?
Are we convinced what?
Are we convinced?
I can't hear.
Someone is, yeah, there could be other factors that cause the immune system to be more receptive to it, no?
Yes. That's why we were saying, it may be because either of the age or diabetes or some other underlying conditions that your immune system react to it. But unfortunately, we don't know why the immune system, because as I said, it doesn't follow the viral load, And some of the medication for inflammation seems to work, but it's not working enough to warrant using it without any studies. But why is this happen? We don't know. And in smokers, maybe again, that's an issue with the effect on the cellular cells, and again, make the lung more susceptible.
Mr. Mann, you have something to ask?
No, I want to make Arvit khalas. There's nothing I know. He told.
Okay. You, Cheryl Gabay.
Cheryl Gabay.
Please go ahead.
Thank you. First of all, thank you for all the information. I have a question. I think it might be a little bit difficult to answer, but as we think about, you know, flattening the curve and then maybe reaching a point where we flatten the curve and things kind of go semi back to normal, how do you think we might approach large gatherings or, you know, lifestyle events like, you know, whether it be like the high holidays or weddings or bar mitzvahs? What do you think that might look like prior to, you know, getting a vaccine for the virus?
Well, even with other viruses, and as I say, like MERS may come in another pan-epidemic, and this is what we are scared. It could be severe. I think we should try to, even in gathering, we should always try to leave a distance. And I think that's what happened in the shower. After that, few people with the kissing, with this, I think we have to make some adjustment to it, because we don't want to go through that again in the future. But the vaccine, sure, when available, but that's why always they keep saying it's not wearing the mask. It's not doing that. It is the social distance. You have to do that, because you don't wear the mask and say, I'm gonna go and do everything, or because I have a vaccine, I do everything. Still people die from influenza every year.
Okay, thank you very much, Dr. Bekhor. We almost reached 80 people. It was very informative. Thank you so much for your time. And we hope, as I said before, that we could overcome and go back to our normal lives, quote unquote, and celebrate together the next holidays in our beautiful synagogue in the Spanish and Portuguese. God bless all of you. Have a happy Pesach. Kohen Bernardo, take us away for Arvit.
Yes. I will. Hazak Baruch. One very quick announcement that this Sunday, Dr. Ziv from the Sheba Hospital will be speaking at 10 a.m. So this coming Sunday, Bezat Hashem Chol HaMoed Pesach. Dr. Ziv from the Sheba Hospital in Israel. He is from Toronto, but